Let's talk about the aging phase. It's becoming a very common concern for the patients of the present generation, and the age groups affected can vary from as young as 25, and it can go up to 60, 65 years, 70 years. So there's a whole plethora of patients who are involved with the concerns, of course, varying from mild grades to very severe grades of aging. So now let's talk about what are the problems with the aging phase. Young patients can actually experience concerns like alteration of the textures. They can start having very fine lines. It can even be depletion of the volume, especially in the cheek areas, and sometimes even in the chin areas and in the jawline. These problems can actually progress, and as these problems keep progressing in the 30s and in the 40s, patients can actually notice more and more signs of aging, which are depletion of the periorbital fat, which can cause hollowness. It can also cause the tear trough lines in the lower part of the eye socket, and then you can have these laugh lines which are beginning to form. They can become more and more prominent. You can have the cheek fat which is held high up in the youth, and then it gradually keeps dropping. So these are the problems which patients may face as they keep aging. You can also have hollowness of the temples. You can have the jowls sagging. You can also have more and more severity in higher grades as the patient keeps aging into their 50s and the 60s. You can have very prominent nasolabial folds. You can have a complete hollowness. You can have eye bags which are set in, and then you can have the jowls which are very prominent, a lot of laxity, a lot of fat, so on and so forth. So from the mild to the severe gradings, everything has treatments, and fortunately for the mild and moderate aging, you have a lot of non-surgical procedures. So now let's talk about the non-surgical procedures which can address all these issues. Texture of the skin can be corrected with chemical peels. A deep peel or even a moderate depth peel can actually address these fine wrinkles, and this is the least of the least invasive procedures which we do for our patients which want very fine wrinkles addressed. Now when it comes to the other wrinkles, especially on the forehead, especially in the glabellar region, the frown lines, as well as the crow's feet, you have the wonderful botulinum toxin which we give. It has to be repeated every 6 months, and then you have complete address to your solutions over here. Of course, you can also use botulinum toxin to modulate the smile. You can do a lip flip procedure where you can also enhance the shape of the lips. You can also alter your smile just by modifying your technique and bettering your results when it comes to patients wanting better smiles. You can also use botulinum toxin for actually the masseter prominence, where some people will want the masseters to be less prominent so that they have a nice V-shaped cut to their faces. Right. So we've spoken about chemical peels, we've spoken about botulinum toxin. Next comes the dermal fillers. They're so popular because, as you know, with aging you can also have a volume depletion. You can also have malpositioned fat, and you may want to actually fill in those areas which are depleted in volume. So you have dermal fillers which address the cheeks and which also address the chin as well as the jawline, and you can beautifully correct the jawline. You can actually enhance the volume of the cheeks. You can also do build up or volumization of the temples, which is actually another problem with aging. Very rarely we also use fillers for the forehead, but it's a very rare request. Now when it comes to the other minimally invasive treatments, you have The energy devices, which are very, very popular. One such device is the Morpheus, where you can actually give energy in the cheek areas, you can give energy in the jawline areas, you can actually get the skin to be tightened, you can actually alter the texture of the skin. Wonderful device which is used to actually alter the texture of the face and actually enhance some amount of tightening. And you can actually combine it with the other treatments which I have just mentioned, and you can get great results. Right. Now, after this is again a device called HIFU, high intensity focused ultrasound, especially given for the prominence of fat in the cheek areas. You don't want all the fat there because the fat should have been over here, and now it's actually dropping. So you want to address this area, the cheek area, the lower part of the cheek, and you want that fat addressed. And HIFU is another technique where by giving two such treatments spread over a period of 6 months, you can actually address the malpositioned fat in the cheeks. We also do minimally invasive techniques using the radiofrequency device, where under local anesthesia we make small tiny punctures, and we can address the initial protrusion of the eye bags. Very, very minimal, very small grades of eye bag protrusion. We can address it with the invasive radiofrequency technique. And the same thing can be used for correcting a little bit of prominence in the cheek area. A little bit of liposuctioning with this will help you in actually toning down these areas and reducing the prominence of the fat. With the same technique, we can also do the neck, where there is a lot of laxity, there's a lot of fat. You can actually do a radiofrequency liposuction of the neck and giving it a slightly better shape, especially the cervicomental angle. You can actually restore that in early aging. Now, when it comes to the other more invasive, you have the threads. And now in threads, there are so many other threads which can be used, but what we use is the state of the art barb threads, which is called the Aptos threads, because it's got polylactic acid, polycaprolactone, and it's got hyaluronic acid. The rejuvenating effect of these threads lasts for much longer time compared to the other threads. So we have the Aptos threads, and we use Aptos threads in combination with all the other treatments for getting the mid-facial lift. Not only the lift, it also helps in repositioning the volumes, and it also helps in rejuvenation because it has the hyaluronic acid within these threads. And these results last for almost 2 to 2.5 years with these threads. Now, I've told you all about the non-surgical techniques, and still patients want more and more corrections. They have higher grades of aging, and we obviously have the surgical facelift, and we'll talk about the surgical facelifts in the next video.